make sure that what I am seeing is what we want to see, which is basically a little bit of redness. We want the tiniest bit of edema. We want a little bit of, you can kind of see where there's that like laser print is what I like to say. And best thing with 1540 is we do kind of want to do a quicker treatment with it, because the more of that kind of puffiness that we get, the thicker that epidermis gets, we want that laser to be able to go as deep as possible. So we kind of want to work fast with this so that we don't get too much of that puffiness. So we are going to start with a test pulse. It won't be bright for you guys. I'm wearing my safety gear though, but you guys are all good. All right, gonna go right here. 3, 2, 1. We just give it 30 seconds just to make sure that what I'm seeing is what we're going for. So given the lighting, you guys might be able to tell. I'm gonna go the tiniest bit stronger. 3, 2, 1.
Gabby?
Yes, ma'am.
Just a frequently asked question is, can this be done on all skin types?
So it can be done on darker skin tones, unlike IPL. So 1540, yes. IPL, as far as if you have oily, dry skin, yes. We go up to a Fitzpatrick 3, which I like to say, as far as the Fitzpatrick scale goes, Fitzpatrick 1, think of a very freckly person that always burns, redheads. Fitzpatrick 2 would be more like me and Stevie. And then Fitzpatrick 3, I want you to think of that really golden olive skin tone. Like think of New Jersey Italians, you know, there does have that extra pigment where they're not likely to burn. They still could, but normally they have that really golden tan going on. As far as 1540 by itself, we can do a bit of a darker skin tone, where we get into that Fitz 4 kind of area. That could be more like Indian, some Asian backgrounds. It kind of just depends. We always, when we have darker skin tones, I do like to do a test pulse, because we just want to make sure that what we are doing on your skin is going to be safe for your skin. But we do have a bit more freedom with 1540 by itself. All right, Stevie girl, we're going to get zapping. So you guys will be able to see how quick this really goes as far as treating a full face. As when we do 3 for me, this is kind of like the final lap. It goes pretty quick where, you know, normally with IPL, I'm giving countdowns and we'll take breaks. This one, at this point, you're just kind of like, this is fine. Let's just get it over with.
So is Stevie doing it without any numbing?
Yeah, so I've actually found, I've had a couple 1540s recently. And if anyone, you know, people that have talked to me, they know I'm world's biggest baby. With numbing, it kind of makes it more difficult. So I found for Stevie, she is just like a total beast with treatments where she doesn't need any of the extras. For me, I've actually brought in a handheld fan, and having that cool air blow on my face makes it so much easier. So now, you know, if you come in for treatments, it's been a while and you're like, why didn't I get offered this fan last time I was in? It's because I just found out that it is my holy grail for 1540. And I don't know if it's more about that distraction or the cool air on, because your cheeks will feel a little hot after 1540. But I found numbing almost makes it worse. Especially if you're doing a 1540 by yourself. When we do a 3 for me, we just do 1 pass of this 1540. When you do it by yourself, you can have up to, some people can even get up to 6 passes. Like my mom is a total beast when it comes to her skin, where we do 6
Wow.
passes on her. And,
Dang.
yeah.
Okay.
So with numbing, people find that when you are doing more passes on the face, each pass is kind of just as bad as the last. Without numbing, those passes, you start to feel them less.
Mhm. I would say the same. I think IPL, I'm more jumpy on IPL than I am 1540, and I don't really have too much of a problem with it. I think what is good for people to know is, IPL goes after, like you said, the pigment and vessels. But when we talk about the ocular surface and we're targeting around the eyes, this is really fabulous for improving structure function of upper and lower lids. So literally we can go, if we had to, over the lids with metal shields in place if we really needed to. But we do see some revitalization of glance with this, which we weren't anticipating. So that's been kind of cool for our darker complected patients where we really are stuck. Our Asian Americans, we can't do IPL at all on because melasma risk is so great. And we have a lot of docs in my arena going very cavalier with that IPL on our Asian Americans. But the folks who really understand, and our plastic surgeons and derms, really don't want you doing that. It's just too risky. But you can see how nice and flushed Miss Stevie's getting. That's quite impressive.
And the thing is, I'll see if I can find my photo of after my last 1540. Within 15 minutes, that flushing is like completely gone.
Yeah.
So it looks more like you have a bit of a glow after, like, you give it 15 minutes and
Mhm.
you feel completely back to normal.
Do you find, I think we've heard a lot of people loving this right before doing the wedding. How many days ahead would you recommend doing a treatment like this?
My rule of thumb, because everyone's a little bit different, I say get this done a few months, like try it first before you're like, let's do this before the big day, because everyone's a little bit different with response. So like for Stevie, when I'm mean to her with 3 for me, she's gonna be red for a couple of days. When I get a 3 for me, within an hour, I like forget I've had it done. So my rule of thumb with anything, whether this is facial services, waxing, anything like that, always do a test run a few months before the wedding. Because another thing I find with 1540, which they've actually had studies, smaller studies that say that this helps with that deeper kind of cystic acne that people get around the mouth, which is something I'm blessed to have. There's been a smaller study that shows that 1540, since it has that collagen properties, it helps to make those pores a little bit smaller. And so for me, it will help with active breakouts, which is awesome. So I really just say it really depends. I would have it done before an event and see how your skin responds. For me, this is something where I'm like, yeah, I would do this like a week before an event. For other people, it might be like do a series a month before your event so that you can, be kind of none of this post redness and all of that.
Right. So maximizing that collagen, remodeling, the
Even
fibroblast.
better,
Yeah.
you do 3 to 6 months before an event. That's going to be your
Yeah.
max collagen from the series.
Well, I laughed because our oldest son got married this summer, and I have siblings, 2 sisters, who literally came up to me and went, "What have you been doing?" I'm like, "Good skincare, good sunscreen." We all grew up in Southern California. And I go, "IPL and fractional laser." And they're like, "Oh, maybe I need to come to your office." Suddenly, I've been talking to them about this for a while, but then they hadn't seen me for a little while. So it's really interesting to see that. And also too, doing the dermaplane to make that skin glowy, fresh, and beautiful. Really amazing. So we've had a question on darker complected patients. Could this be another wonderful help for dry eye? I'm going to say technically yes. We don't have the supporting studies on this just yet, but what we have been seeing in some of our patients who I can't do IPL on them because of their pigment, and the only thing we've had at our disposal to this point has been radiofrequency. We are seeing folks who've gone through and done some radiofrequency fractional together, getting some very good results with the meibomian gland. So definitely would love to do some kind of study here where we could show before and afters with meibomography. That's that crazy machine where we use infrared to image the glands. But I really think this could be a huge, huge thing for our patients of color because we've been pretty limited. That's one of the questions. What else here? How do you use retinol with 3 for Me? I'm going to let Gabby answer that.
So with retinol, you discontinue it 2 weeks beforehand. And this is with any light-based treatment. Like even if you were getting laser hair removal on your face, you would want to discontinue the retinol. For me, since I'm a sensitive lady, I discontinue retinol for 4 weeks. Technically 2, but I give it the full 4 just because I'm anxious. But yeah, you have one thing going on at a time. Retinol to me, that is like, if you're using retinol, then you could be doing, you could dermaplane, which is getting all that peach fuzz and exfoliating. Your retinol is going to go a little bit deeper when you do that, so you can get more benefit from it. There are other, like, you can get the fluffy type of facials done, but even like with retinol, you want to avoid waxing during, so there's a lot of things that retinol will sensitize you to. So I always say use caution because retinol is no one to play around with.
Yeah, that's a good point. Really good point. So you put some moisturizer on, or what are you doing now, Gabby?
So we did some Revive moisturizer, hyaluronic acid. When that moisturizer is going to help just kind of, because after 1540, your face can feel a little bit tight. So getting that moisture on will help with that. And then we're doing a tinted sunscreen. So you can even see, you can still see a little bit of pinkness, but it helps tone that down. Where I've gone to the grocery store with the puffy red face, which, for me, I'm like, I don't care, but it's not too crazy where people are going to be staring and pointing at you.
Right.
So the tinted sunscreen does help make it where you can still go about your day, because you do, you want to be avoiding that sun exposure. And the main things is heat post-treatment you want to avoid. So no hot tubs or saunas, no intense workout. So if you had a triathlon to do it before your 3 for Me. And sunscreen is your best friend, but otherwise just doing gentle skincare, moisturizing is the best thing you can do post-treatments.
Okay. I think that sounds great. Terry's asking, obviously Stevie has had 3 for Me before. Do you need a series of treatments for good results, and what kind of maintenance treatments are necessary? Oh, that's a great question, Terry.
So if you're doing it purely for beauty reasons, the recommendation is between 2 and 5. Now, I like to add kind of a caveat to that. If you have really intense rosacea, you're going to be more on that 5-6 range, because it just takes time to kind of chip away at that redness. As far as collagen, like alone for that purpose, my kind of sweet spot is 3 to 4. So it really kind of depends on all these factors that we're going after, how many, but normally the 2 to 5 range. And then it is touch-ups every 6 months to maintain that.
Great. Lark says, is Stevie alive?
Yeah, she's all cozy in her blanket.
Yes, we use the weighted blanket because it just calms you down. And so, yeah, I don't know if Stevie's going to make it for the afternoon clinic. I think she's just going to go back.
She has no choice. Sorry, I love you, Stevie, but sorry.
I think we had another question: is how is pain compared to laser hair removal? Much more reasonable than laser hair removal. That really, I don't know, that's a zinger for me. I hate it.
Yeah, which, to be fair, so I've only had laser in school, really, and I had my underarms done, and yeah, um, it. So it's a different type of hair. So it depends where you've had laser before, because I've
Yeah.
had laser hair removal on my legs, and that was bearable. Um, it kind of depends. If you've had laser on that kind of darker, coarser hair, that's spicy. That's pretty intense. Um, First time you get a 3 from me is, I say it's the worst time the first time because you don't know what to expect. Once you've had it
Okay.
before, then you're kind of like, next time you know what you're going into, and it's not as bad because we're also chipping away at that
Yeah.
pigment each time we do an IPL. So first IPL you ever have, that's as bad as it'll get, unless I decide to be mean to you one day.
Be nice to Gabby.
Nice to Gabby. Well, Jillian says laser hair removal hurts way more exclamation points. So I would agree with you too, Jillian. I think that's great. Then another question is, once the laser has taken a full effect, how long do the results last? I think that's a great question.
So when we look at, again, IPL, you are gonna want touch-ups every like 6 months. With 1540, you see the most collagen and elastin after 3 to 6 months since your last treatment. And that's where it's like, okay, since this takes 3 to 6 months for this collagen to form, let's do it again at that 6-month mark so that we just keep that continuous cycle of keeping that collagen in.
Mhm.
So I would say, I mean, it's still like, if you needed a whole series at the start, when you have that 6-month touch up, it's not like you're right back where you left off. It's just slowly starting to creep back where you start to notice it. Same idea like when you get Botox done and you're like, I can kind of move my brows a little bit. I'm going to need some Botox soon. It, you know, so it kind of just, it's keeping you where you want to be with those maintenance treatments. You're still going to see results, even like, I shouldn't say this because Dr. Foley will get mad, but like, you'll still see results 2 years out. You'll still be like, this is better than before. But we want to keep you at that point where you are happy at the very beginning, so that you don't have to come back in 3-4 years and do a whole 5-6 treatments again.
Yep, that makes sense. And I mean, if anybody's seen, Stevie's skin, you just kind of look at it and just go, he cannot be, we will never reveal her true age. But, it's, she just looks really glowy all the time. It looks just porcelain, beautiful. So she's very good at this. And of course, she's very good with her sunscreen, much better than I was. And I try to do better. I think we had another question about other things that, Gabby, that you're starting to, offer here in the practice. I think the dermaplaning is the biggie. And can you speak to that a little bit?
Yeah, so other than the services with the light-based treatments, so we have IPL and 1540, we have microneedling. So that can be done for just the under eye area, which helps boost collagen there. It's very similar to 1540, how it boosts that collagen by doing a micro injury, where then your body is like, come heal the face. That could be done for the full face. That can be done for just an under eye area. We do have the first FDA approved microneedling pen. And so we can do that. We just brought in dermaplaning, which for some people we can add on pre-IPL treatments if you've had IPL done before. Because I will say dermaplaning is exfoliating, and some people I can just tell by how I've done treatments on them in the past. I'm like, you're too sensitive to have this done before IPL. So, but it could be an add-on to already you're doing a dry eye treatment, or it could be just a standalone where we do cleanse. We have a little oil massage that we do to make sure that any of those sebaceous filaments, we're getting those out of there. The oil helps to break those down. And then it's basically, think like a scalpel to shave the face, where it does get those extra dead skin cells off. And Amy loves this one.
Love it so much. I want it done every week, but Gabby will not allow me to.
Every 2 weeks is Amy's rule. But yeah, just having like feeling your cheek after you've had it done is the best feeling ever. And especially if you're like a makeup person, your makeup applies so smooth. I will be at some point, I need to wait till it's time for me to dermaplane my face. But I'll try to get a side-by-side comparison of half and half to be able to show you guys. But, and then also skincare products just absorb way better once you get those top layers of dead skin off. And yeah, so and especially in the summer when you're going out to dinner, you're sitting outside, the sun's coming down, and then you see, boom, peach fuzz. I can't not dermaplane in the summer.
Well, you know, it's so funny because I remember being a little kid at a wedding and seeing this aunt, and she gave me a hug, and I saw all these, like, I'm like, what is that? It looks like cat hair. And I remember as a little kid going, oh, and then of course, as we get older, that just gets worse. What age do you see that it just, I mean, it seems like women over 50, I notice it a lot.
I feel like a lot of it's genetic too, because I'm a peach fuzz girl.
Yeah.
So, and I turned 25 this month, so I have a lot of it.
Oh, dear
Baby.
God.
You poor baby.
We so wish.
The Italian hair.
Yes, so we have another question. Can patients do dermaplaning plus 1540 in the same session?
Yes, again, it's one of those things where I would want to have done a 1540 on you in the past, just so I know how your skin responds, but definitely. Same with if you had a 3 for me, like Stevie, we dermaplaned her today. She's getting princess treatment today. We're doing all the things, but also like I've zapped Stevie many, many times. So I
don't give out her secrets. Come on now.
Many times. Many times.
She woke up looking that beautiful every morning.
Oh, that's great. Oh, very cute. And you're saying happy birthday, glamour girl. Great event. Oh,
I know
that's so sweet.
It's a scary one. I get to rent a car now. Look out, everyone.
Yay! Awesome. Super exciting. Well, gosh, we've had such a great group of people tuning in today. And again, you know, we're going to have a prize. So boom, 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 boom. We need to have like, woohoo. Miss Amy is playing Stevie today. Thank you, Gabby. Thank you, Stevie.
Yes. And thank you for all the questions. We love the questions, you guys.
Yeah.
All right. Let's see. Dun, dun, dun.
So what we are giving away, if we haven't mentioned already, is your choice of sunscreen. We have the regular, the tinted, and then we do have a powdered sunscreen that we like to do for reapplication only. So this is if you're a makeup wearer, so that you can do every 2 hours, reapply, or if you don't feel like putting on a liquid. I don't recommend it by itself though, so just disclaimer.
Okay.
All right,
Drum
here
roll,
we go.
Please. Who is it gonna be, Amy?
Rebecca G.
Ooh, Rebecca G is getting some free sunscreen here today. And I love our sunscreen so much because, as you guys know, I'm a nerd on ingredients and making sure it doesn't damage the ocular surface. That's why the whole skincare line we have is not inflammatory to the ocular surface. It's pH balanced. But this is the only skincare slash mineral-based sunscreen that does not damage the ocular surface. You can put it on the lids. That is an important place to really be good about taking care of yourself. It's the thinnest skin of your face, and that gets damaged the fastest and can cause more ocular rosacea. So please have something that's safe. It's the only one I found so far. So yay. That's our sun kiss, right? And that's what Rebecca's gonna get. You lucky you. All right, you wonderful people. We want you to be able to get back to work, and we so appreciate you coming. We'll be putting this up on the website. So if you get bored someday, you want to go back and repeat and learn all the wonderful stuff that Gabby has taught all of us, and we continue to learn. Please come back next month. We'll be doing it on We got mineral air next month. And so you're going to get to see that. That'll be really cool. Dermaplane and then do the mineral air on one half and the other half. We love that stuff. It just makes you look so smooth and beautiful. All right. Thanks, everybody. See you next month,
guys.
Bye.